Hi folks, this is Dr. Burke Mays with Pathways Integrative Health Center. In our office, we specialize in supporting and helping people dealing with long-term chronic conditions. And a common chronic condition we see a lot, like an underlying cause to them, is an undiagnosed or poorly managed thyroid condition. And one of the common ones that we see is what's called Hashimoto's thyroiditis. And if you look in literature, in 1998, the Bible of Endocrinology published a paper, and in that paper they concluded that 90% of hypothyroid has an autoimmune component to it. So what does that mean? That means that your immune system, which its job is to defend your body from foreign invaders, from bacteria, from viruses, from fungus, anything foreign in your bloodstream, your immune system identifies and destroys. And somewhere along the line, your immune system has gotten confused, and now it views your own tissues as being foreign and starts to attack them. That can affect joints, which are like rheumatoid arthritis. That can affect, well, in our case, we're talking about the thyroid gland. It affects the thyroid, either the proteins within your thyroid that help you make your thyroid hormones, or the transport mechanisms that carry it around, but your immune system is attacking those, which then shows up as a hypothyroid or hypothyroid-like symptoms. But your labs may look normal, and this is what I see a lot. You know, in the standard approach for dealing with thyroid issues, they run one test, maybe two tests. They run a TSH, they run maybe a T4, but they don't investigate, is there autoimmunity? And I'll have patients come in and they're dealing with the common symptoms of low-functioning thyroid, the weight problems, the poor energy, the brain fog, the digestive problems, the cold sensitivities, all those wide ranges of things that happen with poor thyroid function. And they say, but doctor, my healthcare practitioner said my labs are normal, I'm fine. But we run the testing that we run, where we run very thorough testing, and we actually can, most of the time, we can see the underlying cause, the autoimmune condition. And it's interesting to see patients either that get upset that this was never looked at before, or they get excited that now we have something we can do about it. So what do you do with the Hashimoto's thyroiditis? You have to address some of the causes. And one of the big causes is, I use the term loosely, detox. The technical term we use is hepatic biotransformation. I like to keep that a little bit separate because there's lots of detox teas and potions and things you can buy all over the place that might help your body dump toxins. But if your system is not prepared to eliminate them, you don't win the game. But toxins are a big stressor on your immune system. And where do toxins come from? You know, when you step outside, you take a deep breath, you take in more chemical compounds than our forefathers did in their entire life. That can be they can be in their foods, they can be in the air, that can be, you know, the different chemicals, drugs, pesticides, all those things that are chemical stressors on our system. Another big one too is we've got to decrease inflammation. Inflammation is literally happening at a cellular level. We call it meta-inflammation. And that takes up a lot of energy, and also inflammation is going to block the activity of all your hormones. It also puts a huge stress on your immune system. And then that goes hand in hand with detox, because detoxification is, elevated toxins are big inflammatory components. Lastly, we got to deal with the immune system, and that almost always comes down, we have to deal with the gut. You know, allegedly Hippocrates once said that for the source of all disease, look first to the spine. And I think that actually that we've kind of have to rethink that now. For the source of all disease, look first to the gut. If you think about it, you make about 60 to 80% of your neurotransmitters for your brain, serotonin and dopamine. Those are made in your gut. You also, 80% of your immune system is gathered around your gut. So if you have digestive problems, there's poor digestion, that indicates poor digestive function, inflamed gut, break down your gut, and the whole system gets thrown off. And the first place it shows up is in brain activity and also in immune stress. So calming those things down, detoxification, decreasing inflammation, restoring normal immune system function can make a big difference in getting down to the underlying cause of why Hashimoto's thyroiditis is present. You know, if you work in a health practitioner and they're not answering these questions for you, I encourage you to give us a call. You know, often we'll do a courtesy consultation over the phone to see if what we do in our office might be the right fit for you. Our number is 763-634-5892. You can reach us on email, which you'll see here at the end of this video. Thanks for watching. Look forward to seeing you in my next video. Have a great day.